Hey everyone, we are on our third stop of our tour and we are going to be talking about health insurance. So, as I do this section, you're going to hear a lot of health insurance lingo, and a lot of times it just sounds like a bunch of gobbledygook. So, I just want to take a second for us to go over the words that you're going to hear me say quite frequently. The first one is premium, and that's the monthly amount that you're going to be paying each month so that you can have the plan. Coinsurance is the amount that you're going to be paying after you have met the deductible. That's where you're sharing the cost with the insurance company. Deductible, that's the amount before your plan starts to cover the cost. That's before your coinsurance kicks in. A copay is the amount that you're going to pay every time you go into the doctor's office for services or you go and pick up a prescription. The plan summary is an outline of all the services, deductibles, copays, and the coinsurance amounts for each of the plans. And then if you ever see EE, that's for employee. If you ever see ER, that's for employer. So we offer several different plans. We have our Anthem PPO plans, which are Key Advantage 250 and Key Advantage 1000. We have the Anthem High Deductible Health Plan, and then we have our HMO, which is with Kaiser. Now, please know that all of our plans come with medical, dental, vision, and prescription coverage all built into the plan. So it's like an all-inclusive cruise. Everything's included in your plan. So I just want to show you a really quick video on the differences between a PPO, an HMO, and an HDHP, because I think it will help you narrow down the plan that's going to be best for you and your family.
When choosing a medical plan, you sometimes have the choice of picking between an HMO, PPO, or HDHP plan. Let's talk about what these letters mean and the key differences in these types of plans. First, an HMO, or Health Maintenance Organization, is an insurance plan that may offer lower monthly premiums, the cost for the insurance, but also gives you fewer choices regarding where you can receive care. The insurance provider has a list of approved doctors for you to choose from to receive coverage, meaning there are some doctors you cannot visit using your HMO plan. With an HMO, you must designate a primary care physician, or PCP. Think of your PCP as the main doctor you visit for routine medical care. With most HMOs, you must first visit your PCP and get a referral to see any specialists you may need to visit. And with an HMO, every time you see your primary care physician or a specialist, you pay a predetermined flat amount called a copay, no matter how many times you visit. A PPO, or Preferred Provider Organization, is a plan that gives you more freedom to choose from a larger pool of providers, but generally comes at a higher monthly cost. While the network is larger in a PPO, there are still providers that don't fit in. You can choose these out-of-network providers and get some coverage. However, you usually end up paying more for those services. PPOs do not require a primary care physician, therefore eliminating the need for referrals and giving you the ability to go directly to a specialist. Finally, an HDHP, or High Deductible Health Plan, is a different type of plan altogether, aimed at giving you the most control over your health expenses. HDHP medical plans typically offer the least expensive monthly cost for coverage, but require you to pay all of your healthcare costs that are incurred until you meet the deductible that is listed on the plan. These plans keep your costs low if you don't utilize it a lot, but keep you financially protected in cases of catastrophic illness or emergency. HDHPs are similar in structure to a typical car insurance policy. For example, if Bob's Auto says it will cost $5,000 to fix your car after an accident, and you have a $2,000 deductible on your auto policy, you will be required to pay $2,000, and the insurance company will pay the remaining $3,000. The higher the deductible you choose for your medical plan, the smaller the monthly cost will be. But it also means when you have health expenses, you are responsible for all the costs up to that deductible amount. Generally, HDHPs use what is called coinsurance to determine how much you pay for services after you meet your deductible. This is the percentage of a bill that the insurance company will pay at that time. For example, after hitting your deductible, if you get a medical bill for $1,000 and your plan has a coinsurance benefit of 80%, the insurance company will pay $800 and you must pay $200. The coinsurance eventually stops and the insurance company starts to pay for 100% of all healthcare expenses when you have personally spent the amount listed as the out-of-pocket maximum on the summary of benefits for your HDHP plan. To sum it up, HMOs offer lower monthly premiums but limit the choices you have for doctors. PPOs offer more choices for doctors but typically cost more on a monthly basis. And HDHPs provide the most flexibility for you to manage your healthcare costs, typically offering the lowest monthly premium but requiring you to reach a deductible before benefits become effective. And now you know the differences.
Okay. So there's just some basic information I want to go over before I really start talking about each plan. With health insurance, you guys have 30 days to submit your form. And that's a hard 30 days just because I have to have them turned in for ACA regulations. So this is a form that I need regardless of whether you're going to enroll in insurance or waive our insurance. Once you make your election, you will not be able to make a change to that plan until open enrollment, which I hold in April, unless you have a qualifying mid-year event. And that could be something like having a baby, getting divorced, getting married. So there's lots of things that can happen throughout the year that may make it eligible for you to make a change. Your coverage is going to take effect the first of the month. So let's say my hire date is going to be July 4th. If I'm hired July 4th and I turn in my paperwork before July 31st, then my insurance is going to start August 1st. But I have 30 days, so which really means I could turn it in all the way up to what, August 3rd, 4th? So if I turn it in after the 31st of July, but before my 30 days are up, then my insurance is going to start on September 1st. So really it depends on when your start date is and when you turn your forms in. We are billed a month in advance, so we pay a month in advance, which means if I'm someone who has a July 4th start date and my insurance starts on August 1st, then I would be paying in July because July is paying for August, August pays for September, September pays for October, and so on and so forth. So you may have an adjustment or a double deduction on your paychecks because we would need to get you caught up to make sure that the full month is paid for. If you're going to add a dependent, you can have either a spouse and or children. If you're going to have a spouse, I need a copy of your marriage license. And if you're going to add a child, I do need a copy of their birth certificate. I have the form for enrollment down here on the link. It's also going to be included in the Google link that's going to be sent out. So just remember, this is a very important form that needs to be completed. So here are our insurance rates, and you can see all of our plans listed here. And then you can see the coverage level, how much the full amount is, how much we as the employer are going to pay on your behalf, and how much you as the employee will be paying. Now these are monthly amounts, so you get paid bi-monthly. Make sure you divide it in half if you want to find the per pay amount. Now you're going to notice that we have comp and prevent. That stands for comprehensive and preventative. I'm going to go over what those mean in just a few minutes. So we'll start with Kaiser, and Kaiser it's very comparable to our PPO plans. It does not have a deductible that needs to be met, which is great, but it does have your co-pays and co-insurances. And it's really easy to use because there's facilities all over, and they're really opening up a lot more. I know one in Woodbridge is coming up soon. I think one out in Gainesville. So they're kind of popping up all over. I think the closest one to central office is at the Bull Run Shopping Center off of 234. So when you have Kaiser Permanente, it's like a one-stop shop. Whenever you need services provided, you're going to walk into your Kaiser facility and they can do x-rays, blood work, just their normal, run-of-the-mill. Maybe I have strep throat or a cold. They can also do your annual physicals. So anytime you need to be seen, you're going to go in there. Now, if you need to see a specialist that they do not have, you do have to have a referral before you can be seen by the specialist. Now, as I mentioned, dental and vision are built into all of our plans. So if you go with Kaiser, you're going to have Dominion National Dental as your dental provider and Vision Essentials by Kaiser as your vision provider. Now, I have the plan summary here. If you just click on that, it will give you a complete description of all the services. If you decide that you're going to participate in the Kaiser plan, just some things to know. There's a mobile app and there's lots of things you can do on it. You can schedule your appointments, get refills on your prescriptions, look at lab results, check for costs. There's lots of things that you can do with that. It also allows you to have a med alert. So if you go in and you get put on an antibiotic and you need to take it every 6 hours, you can have it set up on the app so it will remind you every 6 hours to take your medication. And then if you're traveling away from home, there's the number that you're going to want to call if you have any questions. Please know that this program is just for our local area. So if you have children that are going away to college, not in this area, this is not going to be a plan that you're going to want because they won't be able to get services outside of our network area. They also have wellness coaches. You can do video appointments where you just Skype with your doctor. A lot of people are doing that right now because of the COVID. They also have a lot of material. So if Spanish is your primary language, they have lots of things that you can use. They also have a maternity program. So now we're going to talk about Anthem, which is our PPO and our high deductible health plan. And the Anthem plans all have the same services. And the difference between them is going to be in your premium, your deductible, your copay, and co-insurance. So when you're looking at the 250, the 1000, and the HDHP, they all have the same services. They're just built differently in terms of how much they cost per month, how much your deductible and copay and co-insurances are. And when you get your insurance card, you're going to use that one insurance card for everything. So you're going to use it when you go see your doctor. You're going to go when you see the dentist, you're going to use the same one. It's the same thing when you go to have an eye appointment. Everything is going to be on the same card. And it will always be the policyholder's name on the card. So it will not have your family members listed on the card. It will just have your name. Now, the vision administrator for them is Blueview Vision, and the dental is Delta Dental of Virginia. And that's where you're going to pick the preventative or comprehensive portion of it. And we'll go over that in just a minute. So here you can see I've kind of outlined all three of the plans just so you can get a general idea. So the 250 is going to cost more every month than if you were to pick the 1000 or the high deductible health plan. Your deductible, though, is going to be lower than if you'd pick the higher, the 1000 or the HDHP. And then you'll have to just look at your copays and co-insurances. Your copays and co-insurances are a little bit less than the 1000 if you pick that plan. Now, if you pick the 1000, it's going to have a lower premium than if you had picked the 250, but a higher premium than if you had picked the HDHP. It has a higher deductible than the 250 by a pretty good amount. So you'll want to make sure you look at the plan summary. And then a lower one than the high deductible health plan. And then you'll just want to look at your the plan summaries again for the copays and co-insurances. Now, the high deductible health plan is one that has the lowest premium. It has the highest deductible, and then you'll want to look at the plan summaries again. So you can click down here for the plan summaries. They will be on that Google link and available to you. So comprehensive versus preventative. So when you enroll in an Anthem plan, your dental services are through Delta Dental. And you need to decide whether you want to have preventative dental coverage or you want to have comprehensive dental coverage. So the preventative, which is up here, it covers your diagnostic and preventative services only. So basically, you know, your tooth cleanings and an x-ray, maybe a fluoride. So if you chip a tooth, get a cavity, need a root canal, you would be paying 100% for those services. Now, the comprehensive, it costs a little bit more every month, but it includes the preventative services as well as other services for primary dental care, major dental care, and some orthodontic benefits. And you'll notice here too that there is a very, very small copay that is associated with it. So I have down here the full brochure so that you can see it a little bit bigger. I know this is kind of microscopic, so click here and it will show you the entire brochure. So if you decide to do an Anthem plan, they have a Future Moms program. And if you enroll in the Key Advantage 250, and it's only for the 250 that this I mean, everyone can enroll in the Future Mom program, but only if you enroll in the 250 and you complete the program. They will waive your hospital stay, which I think right now is at about $400. They have lots of resources for condition care. They have a 24-hour nurse line. They have a mobile app as well. They have Live Health Online, which again is where you're Skyping with your doctor. One of the cool things about Anthem is that they also offer it so that you can speak to a psychiatrist or a psychologist, which makes it really convenient for you. Then they also have home delivery for prescriptions. So if you're someone who takes a prescription every day and you can get a 90-day supply, it can be sent to you through the mail. And when they do that, you're only charged for 2 months of prescriptions, which means you get one month of prescriptions for free. And then they have a global care program. And with our Anthem plan, this is accessible anywhere in the United States. So I'm going to be sending out the Google link. Please check out all the plan summaries. The rates are there, and the form that you need to fill out is there as well. So just please remember, I do need to have that within 30 days. If you have any questions about your cost or when the cost is going to start or when your health insurance can start, please just contact Debbie or I, and we'll be more than happy to help you out.